Hello and welcome to the EduTalk series hosted by Biotone Edu Partner Program, and massage industry experts. With the challenges facing massage schools, students, and practicing therapists, the EduTalk series continues to support virtual learning and building massage community by connecting you directly with industry experts who share their knowledge and expertise for not only class discussion, but career success. Tonight's expert is Kerry D'Ambrogio, president of D'Ambrogio Institute. Kerry is also a doctor of Oriental medicine, a physical therapist, an osteopath, an international lecturer, and author of Positional Release Therapy. Let's listen and learn as Dr. Kerry reminds us of the importance of screening your clients prior to beginning treatment. Dr. Kerry will use a case study of an injured neck to review how a 5-minute total body screening examination will help you determine if you should take a local or total body approach to treating your clients. Kerry, thank you for joining us tonight. And everyone, please be sure your video is off, you're in speaker mode, and you are muted. Please use your chat box to ask Kerry any questions, and he will gladly answer those at the end of his talk. Thank you, and Kerry, I turn it over to you.
All right, Joanna. Perfect. Thanks, Danelle. All right, so we got 30 minutes here. All right. So you should be getting this handout. I put together a handout for you that has everything in it, total body screening examination. And you should also be getting this 2-page handout. Now this chart, which is, I'm going to use this tonight, is 30 years in the making. This is how I make my decisions on what I'm going to do with patients. So in putting this talk together, I thought I'd come up with 4 bullets that I want to talk about. You know, why do we evaluate? How do we evaluate? And also when somebody comes in this case, I do a case history of a neck, what's a local approach to treatment and what's a total body approach to treatment. Now, I heard good news for massage therapists here in Florida that you've been allowed to do assessments. I think that's long overdue. My sister is a massage therapist in Canada, and their schooling is 3 years, and they all do assessments. And I think this is something that's very important. So hopefully you'll get a little bit out of tonight. So why do we evaluate? Well, we evaluate for those patients that kind of fall through the cracks. These patients go from doctor to doctor, therapist to therapist. They spend thousands of dollars with little or no results. They may have had failed surgeries. They're over-medicated. And a lot of times they've lost all hope. How can you treat if you don't evaluate? If you don't evaluate, then you're kind of performing the same treatment on each individual. And what happens is when patients come in, we need to figure out what do they need. All therapies work. So evaluation is so important because it's going to help you decide whether this is a local problem to treat and what type of problem, or if it's a total body. And as you begin to evaluate, treat, and reevaluate, this is how you develop your wisdom. This is how you develop your connections of what, how does the body work, whether an emotion is affecting it or whether it's caused by a muscle or joint. This is how you develop, all your skills. So how do we evaluate? I'm going to use a comparison of 2 people coming in, and these are actual patients. So the gentleman was an accountant, and he had neck pain and headaches, and it was during accounting season. He was rather tall, working at his laptop in poor posture, and just lots of hours, like going 14 hours a day, and developed a lot of headaches and neck pain. The woman, on the other hand, had 10 years of head and neck pain. And I'll get into her history a little bit later. What's interesting is they're both very different. Yet, when the patient comes in, what do they want? They want you to treat where the neck is. If they have insurance, the insurance company wants you to treat the neck. If they're being referred to from a doctor, the doctor also wants you to treat that neck. And where does that come from? It's in our medical model. It's Cartesian theory. or reductionism, or some people call it mechanistic theory, is that it's symptom-based treatment, isn't it? So if someone complains of a pain here, that's where they want you to go. And it doesn't always work out that way. So these forms that we gave you are going to help you making a decision. And the first thing we want to do, and that's what this lecture is about, is a total body screening examination. And so when a patient comes in this case, we have the 2 neck patients coming in, I have to decide very quickly whether I'm going to treat their neck or it's coming from somewhere else. Okay? And so I do a 6-phase evaluation, which takes about 5 minutes, what Donnell says, with practice. It'll be a bit longer explanation tonight, but once you get the hang of it, it's very quick. The first thing is a postural scan. And what you're going to do here is you're going to be placing your thumbs on the base of the occiput, and you're going to be measuring to see if it's lined up or not. And why are we doing this? Well, structure affects function. So right in here where the occiput is, there's an opening. It's called the Jugular Foramina. And this is a foramina that's created by the occipital bone and the temporal bone. And why is that so important? Because the vagus nerve pops out of there. So this is a quick autonomic nervous system evaluation. So why would this be important? Because the autonomic nervous system controls vasomotion of the blood vessels, and that's how body heals. Like, how does the neck heal? Blood supply to, within, and from, but also drainage from that area, venous drainage, lymphatic drainage, and also nerve supply. I talked a lot about that in my last lecture. The other parasympathetic area we want to evaluate is the sacrum. So we want to evaluate the sacral base, so right in here. And this is where S2, 3, 4, S2, 3, 4 come out, and which are also parasympathetic. So if you've ever done craniosacral therapy, the sacrum and the cranium, that's parasympathetic. And you know that, patients are very relaxed. So I check both those areas. Now, I also want to check the sympathetic nervous system. And this is the sympathetic chain right here. And this is found on either side of the spine. And it's where the rib meets the transverse process. And what you want to do is you want to evaluate. And this sympathetic nervous system basically is from T1 down to L2. Now, L1 and 2 obviously don't have ribs, but it's going to follow that same chain. And it's the autonomic nervous system, again, which controls that vasomotion. The anatomy of a blood vessel is endothelial cells, smooth muscle, and connective tissue. So the smooth muscle is under the control of this autonomic nervous system. So if you're in fight or flight, what's going to happen is your body naturally vasodilates the blood flow to your muscles for fight or flight, and then vasoconstricts to the organs of digestion. If your patient is coming in and they're on sympathetic overload, like one of my patients that we're talking about, the healing is going to be very slow because they're in vasoconstriction. This is why we want to check the autonomic nervous system. We want to check the base of the occiput, the sacrum, and then T1 to L2. So that's our postural evaluation for the autonomic nervous system. The other thing we check really quickly is we're going to check the upper T lines, the shoulder levels. So why is that important? Well, we're going to talk about something called lines of tension. And if there are lines of fascial tension coming in from the cranium or the arms, we are typically going to see the shoulders being unlevel, the upper T line. So it's a very quick check for that. Now, obviously, we will do other checks to verify that. There's also a lower T line where we check the pelvic levels, okay? And this will indicate usually imbalances coming up from the legs. So these are the postural scan, and this takes not even a minute to do. I start at the top, I do the occiput, then I do the upper T line, I run my fingers down either side of the spine, then I do lower T line, then the sacrum. So here's a quick video just showing you the evaluation. And if you want to, you can kind of play along with it and mimic it. All right, we're going to start with the total body screening examination. The first part is going to be in standing, the postural scan. This is a quick scan that we can scan the autonomic nervous system as well as lines of tension. So I'm going to palpate the occiput, so right in here. I'm going to palpate the inferior ridge of it. The reason why I want to palpate that is because structure affects function. We have the vagus nerve, cranial nerve 10, which is going to come out the jugular foramina on the left and right side. That foramina is formed by your temporal bones and your occipital bone. So I'm going to come in here and palpate that. Now, one of the things you have to be aware of is your dominant eye. So one of the dominant eye tests is you put your hand together like this, you look through it, pick an object, and then you want to close one eye and then the other eye to see which eye is more dominant, which is lining it up better. I'm more right eye dominant. So I want to come in here and make sure you measure with a straight ruler. So I'm trying to get out of your way for the camera, but I come in like this and I measure to see which one is higher. Now, we will do other tests in various classes where we actually do tension tests and feel the musculature. This is a quick screening examination. If this occiput is not leveled, it tells us there's a potential to have a problem with the autonomic nervous system, the parasympathetic system here with cranial nerve 10. The other part of the parasympathetic system is the sacrum, S2, 3, and 4. And what we're going to do is we're going to measure the sacral base, S1. So I'm going to come in here. I'm going to palpate iliac crest. I come down, feel the PSIS, come in and up about 1 centimeter. And again, I'm feeling to see if that sacral base is unlevel. I want to make sure my dominant eye, my right eye, is lined up. I would be behind her more, but I'm trying to get this so you can see it. So this is our parasympathetic. The sympathetic is from T1 down to L2. So what I'm going to do here is I'm going to palpate right here where the transverse processes are. Where the rib comes into the transverse process is where the sympathetic chain is. So what I'm going to do is I'm going to start here at T1, and I like to, some people like to do this, where they place their fingers on either side and they kind of run it down like this. You can do that, but I actually like to use my thumbs, get my dominant eye in there, and I actually will come back down and begin to feel those different levels. You can do this with someone's shirt on, and I can be aware of the levels like T1 to T6 is your heart and lungs, T5 to T9 is your liver, your gallbladder, your stomach, spleen, portions of the duodenum and pancreas, etc. as we go down, so it's in your manual. Now, if her shirt was off, we had a gown on it, as I run my fingers down, I could pay attention to see what color is there. If it's red, it's more acute. If it's more white, kind of blanching, it's more chronic. Does it feel moist? Moist is more acute. Does it feel dry? Dry is more chronic. Does it feel focally tender? That's more acute. Does it feel more ropey or spread out? That's more chronic. So we have parasympathetic, parasympathetic, sympathetic from T1 down to L2. Now L1 and 2 don't have ribs, but I can still feel the paraspinals. The next thing I want to feel, we call these the T-lines. So if the spine was like this is the upper T-line, this is the lower T-line. So I want to come up here and again get my eyes at that level, and I want to feel the level of the upper T-line. This indicates lines of tension coming in from the arms into the axial skeleton. I can also come down here and I can palpate the iliac crest. This is the lower T-line. Get my dominant eye in there. And again, this tells me very quickly, are there any lines of tension from the lower extremities coming into this axial skeleton? Now, we're going to confirm this by lying her down and checking her legs or arm. We'll also check her head and neck in the next series of tests. So the next thing we do is look at lower extremities. So what I want to do now is I'm going to pick up both legs, feel the weight of the leg, and I like to go the lighter leg, and I'm going to do a leg vector, which I'm doing a circumduction to feel lines of tension. And then I'll put the foot in my belly and do a leg pump. And I want to pump it all the way up to the cranium and then distract. And I like to do the lighter leg. Hopefully that leg is normal to get a sense of what normal is. And then I do the heavier leg. I compare it. So what I've done is I've checked the autonomic nervous system. I've checked the upper and lower T-line. Now I'm evaluating the legs to see if there's any tension coming up from the legs into the trunk, because I'm trying to decide if this is a total body problem or a local problem. So now I do the same thing with the arms. I feel the weight of the arm, of each arm. Whichever arm is lightest, I'll go to that arm first. I'll do an arm circumduction, and then I'll do an arm pump. Again, I'm trying to assess lines of tension in the arms coming into the trunk. And then I'll look at the head and neck. I'll come to the head, I feel the weight of the head, and I'll do a little rotation to the left and to the right. So here's a little video of me doing the evaluations. All right, I'm going to continue with the total body screening examination. So we've already done the posture evaluation and standing. We're going to check lines of tension in the legs, the arms, and the head and neck, and how they influence the torso. So I like to start with the legs. And what I do is I pick up one leg and then the other leg. I'm looking to see which leg is lighter, which leg is heavier. This leg is lighter. So I'm going to come in here and place the foot in my belly. And I'm going to gently compress in through the body. How far can I go? Typically you like to be able to go all the way to the head. You pause and then you distract. When you distract, you're evaluating lines of tension. When you're compressing, you're evaluating congestion, more of a fluid model. And then I can support her leg and evaluate sort of a circumduction, a leg vector. I can do clockwise or counterclockwise. I'm just feeling any lines of tension into her torso. I come to this side, feel the weight. This side's heavier, so that's the limb weight test. Place it into my belly, I compress. You can see the difference. I can't go as far. So she's got some compression there. And then if I try to distract, there's a problem there as well. When I come in here, right away, this is as far as I go. So she actually has an issue with this hip. You can see it's much smaller motions. Remember, this side was much bigger. So she has something going on here. As I come up, I'm going to check the arms. So I can feel the weight of the arm. Come over here, feel the weight. And again, I would go to the lighter arm. I'm going to stay just on this side just because of the camera. But you do the same thing. Do the lighter arm, then do the heavier arm. It just helps you feel the difference. So I pick this up, and I'm going to support her above and below the elbow, like this. And I'm going to compress upwards. And this is the compression test. So you're testing for any type of fluid. And then I can distract. That's lines of tension. With her palm up, I can do the arm vector, and I can feel for any lines of tension. And I can go counterclockwise or clockwise. So I'm feeling for lines of tension coming into her torso, and I would compare that to the other side. Now I come to the head. I feel the weight of the head, and again that tells me congestion, okay? And I can do a sort of a head-neck vector, where I can flex her up till I feel the tension, and then I can rotate her in one direction, pause, and she has a difference there. You can see she likes to go this way, and she doesn't like to go that way. So those are all the lines of tension in the legs, the arms, and the head and neck. And then we look at the thorax. So now I come up into the thorax, and I'm going to have her cross the arms, and I do a rotation left and right. And what I'm checking is this thoracic inlet area, right? So here it is over here. And then I do a sternal pump. Why? Because everything flows back to the heart, right? And everything also has to flow through this respiratory diaphragm. This is deep lymphatic drainage. This is what I'll be talking about at the FSMTA this year. So here I am over here grabbing the lower ribs. I'm going to twist it to the left and to the right. So why I'm doing this is I want to figure out, is the patient congested? You know, are these diaphragms restricted? Because it affects that vertical flow. Because how does the body heal? Arterial flow, venous return, lymphatic return. These are all the vital structures. And if people are all locked up in this chest area and also this respiratory diaphragm, then they're not going to be healing very well. You're not going to get good flow. And then we check the pelvis and the abdomen. So the pelvis, I'm going to do a rotation to the left and right. That's checking the pelvic floor. With my hands in the abdomen, I'm checking to see if there's any congestion in this area. All right, we're going to continue with the total body screening examination by evaluating the chest region, or thorax, and also the abdomen. So I can get my patient to cross her arms like this, so at 90 degrees. And what I want to do is I come in like this. So I like to stand at the head, or you could also stand at the side. And I'm going to have one hand underneath and one hand on top, and I'm going to rotate her body in one direction, pause to the first sign of resistance, and then go the other way. You can see that she doesn't like to go this way. She likes to go that way. So what am I testing here? I'm testing the thoracic inlet, right? The diaphragm here. I'm also checking any lines of tension that could be coming in, you know, from the arms or the head and neck, sternum into this area. I could also be checking the autonomic nervous system, so the upper thoracic region, Okay, so arms by your side. I'm going to come in here to the angle of Louis, there on the second rib, place my hand there, one hand on top. My elbows are straight. I'm leaning into the table. I'm going to gently compress in. So I'm checking, I'm doing a compression of the sternum, kind of posterior and inferior. Behind it is the heart. So the reason why I'm checking this is because lymphatically, everything is going to flow back to the heart. In the lymphatic system, the fluid is going to drain from a high to a low pressure. If all this is blocked up, you're not going to get good circulation. So I'm seeing, is there a problem there? I'm going to come down here, and I'm going to check this region, these lower ribs. I'm going to place my hand on either side. And what I'm going to do is I'm going to rotate, just like a steering wheel. Rotate everything in one direction, pause, and then come the other. She doesn't like to come this way. She likes to go that way. So what am I checking here? The respiratory diaphragm. This is a key area because all the drainage has to come through here, to come here and then back to the heart. I'm also checking lines of tension in that area, and I'm checking also the rest of the ANS from T1 down to L2, the lower part of that. And when I come down into her belly, we know that everything below the belly button, superficially, so the lumbar spine, the sacrum, the pelvis, both lower extremities are going to drain into the groin. They come together in the left and right lumbar trunk. They meet at sternochyli. They go through this diaphragm, the respiratory diaphragm, and come up here into the heart. So here, I want to feel the xiphoid process, the umbilicus. Place my hand here. I'm going to gently compress and scoop upwards. So normally I should be able to sink my hand in quite far, but if I feel a lot of bogginess, this just tells me that this is all blocked up. And if I felt a lot of heaviness in the legs, especially with a compression test, it's telling me there's problems here. So this is a really good scan to tell me that, you're trying to be a lawyer, you're trying to build a case, you're trying to, evaluate as many things as you can. And if there's lots of tension, it tells you it's more of a total body problem. And if you're only finding a few areas, then it's directing you more to a local body. Now, if it's a total body problem, is it more something for TBB, total body balancing, where it's more lines of tension, more of an orthopedic model, which is like the skyscraper principle? The head is the penthouse, so we clear things from the bottom up. Or is it more to do with a fluid-based model? Okay, total body lymphatic balancing. So if it's more of a fluid model, we can't start at the feet and work our way up, because that's going to block out the whole system. We actually have to start here and work our way out. So it's a big difference. So I want to get an idea with these patients, is this lines of tension or is it more congestion? So when I picked up the legs and I'm, compressing them, is it more congestion? The arms, more congestion? Do I feel things blocked up here, and do I feel a lot of congestion in these areas? The next area I want to check is this pelvic area. So with my hands on each side, I'm going to rotate her pelvis to the left, pause, and now rotate it to the right, and you can see that she moves much easier to the left than the right. So this is checking the pelvic floor. It's checking sort of lines of tension. It's also checking the autonomic nervous system, S2, 3, and 4 for tension. So once again, this is the end. It's a quick screen. Remember, it's not a detailed evaluation. It's a quick screen, and it's telling us whether this person is a total body or a local body patient. Okay? All right, so local approach to art. So let's come back to this guy. So this guy's coming in, and I did that exact same screen, and this is what I found. So with him, I just found that his occiput was off. I found a lot of tension in the head and neck. So when I lifted the head up and rotated it left and right, he had tension, and also his shoulders were off. That's all I found. So there was no tension in his legs. There was no tension in the arms. Everything was localized to this head and neck region. So as a result of that, when we come back to this treatment approach, you can see that he meets the criteria basically for a local lesion. Okay, so this is how I decide. But now, if you look at the bottom, we have muscle balancing, fascial balancing, joint balancing, lymphatic balancing, and energetic balancing locally to do to his neck. We have to figure that out. So here's the local approach. So I use something called ARTS, ARTS. Let's go through that. A stands for asymmetry. So I can palpate the transverse processes to see if they're lined up, or do I see any rotation? Okay. R stands for range of motion. So I can have him or her actively move their neck into flexion, extension, rotation, side bending. And I can also do it passively. And what's the nature of the barrier at the end of their range? If it feels soft and boggy, that's more swelling. Does it feel firm? That can be muscle, that can be fascia, or hard end feel typically is more joint. T stands for a few things. Tissue tenderness. If they have tenderness in there, this could indicate protective muscle spasm. T can also stand for a tension test where I can do a joint mobility. Normally it should be soft and supple, but if it's hard and rigid with a hard end feel, it tells me it's more joint. T can also stand for tissue texture changes where I can feel swelling or a temperature difference. Now S in ART stands for special tests. And fascial glide can be a special test. You know, you can press in and you can glide up and down, left and right, and also diagonal to see if there's tension. Limb weight test. We did that with the arms, the legs, and the head. If one area is heavier than the other, it could mean congestion. And also I teach a nodal evaluation, a proximal node test. So if there's a lot of congestion in the head, I want to see, is there any node congestion here? If there's congestion in the arms, what's happening to the nodes in the axilla? If there's congestion or heaviness in the legs, what's happening in the groin for the nodes? So let's put it together for you. So how do I know I need to treat someone for a muscle imbalance in the neck? Well, when we did the total body screen examination, I just found local findings. There wasn't total body. There was asymmetry in the neck, right? Range of motion was limited and had a firm end feel, but the key finding, tenderness. We use a scale from 0 to 10, so they may have had a 7, 8, 9, 10 out of 10, maybe a jump sign. So this tells me it's a muscle problem. How do I know it's a fascial problem in the neck? Well, again, doing my screening examination, everything was found locally. When I performed ARTS, there was asymmetry in the neck. We did range of motion, there was limitation, and there was a bit of a firm end feel. The key finding was fascial glide. That was restricted. There was a little bit of tenderness, maybe a little joint involvement, but this was the key finding. How do I know I need to treat somebody's joint locally in the neck? Well, again, the total body screening examination, everything was found locally. There's asymmetry, there's decreased range of motion. When I evaluated the end feel, it was more of a hard, abrupt end feel. And the key finding was when I did my tension test, there was limitation. It was hypomobile. It was more pronounced than the fascial glide or the tenderness. How do you know you need to treat lymphatic balancing if there's swelling in the neck? Again, from your findings, everything is localized to that head and neck. There's asymmetry. There's decreased range of motion. And on end feel, it's more of a soft, boggy end feel. Okay? And the other key findings is when I palpate the neck, I can feel maybe a temperature change one side from the other or to the other parts of the body, and there's bogginess there. There's tissue texture changes. Also, the head will be heavier than normal, and also the supraclavicular nodes will be a little bit fuller than normal. Now, how do I know it's energetic balancing? Because we teach that. Usually, again, it's going to be local stuff. There's asymmetry, but everything else is inconclusive. There's imbalances everywhere, but it's not obvious that it's a muscle, joint, fascia, fluid at all. So with this guy, remember, these were his findings. Remember, the occiput was off, upper T-line was off, and the head and neck, he was heavier and limited in that vector. So his problem was he had a muscle balancing problem. Why? Because the key finding I found for him was protective muscle spasm was from tenderness. So when I treated this, for him, it was his levator scapular muscle. And once I treated that, that released everything in the neck. So very easy. So you can see that when I did the total body screen, everything indicated that it was a local problem. When I went through my ARTS, it was very clear. Tenderness was the more pronounced. He had like a 9 out of 10, very pronounced jump sign. And then I just did muscle balancing and we were able to relieve his problem. Now, total body approach. Let's say this woman here. So this woman came to me 10 years of this problem. She saw chiropractors, physical therapists, massage therapists, acupuncturists for 10 years. And what did they all do? They all treated her neck. When I did my total body screening examination, everything lit up. Her left leg that was heavier, congested, left arm heavier, congested. All of her pelvic floor, respiratory, thoracic inlet were off. all the findings in the autonomic nervous system were locked up. She was a very anxious, nervous person coming in. And it was interesting that when she was lying on my table, the left leg was the worst. And I could see that she had it wrapped up. And I said, what happened here? And she goes, well, 10 years ago, I had a car accident. And, you know, I injured my body, but I filleted that foot and I've had 4 surgeries. So there was so much tension. So here's what I did. I stood at the head of the table and I tried to move her neck in different positions. I could hardly move it. As soon as I bent her left knee, I could move that neck anywhere because I reduced that fascial tension. When I straightened that left leg, I couldn't move that. So what everybody was doing is everybody was treating locally, and it wasn't a local problem. It was a total body problem. And I found that within 5 minutes doing the total body screen. I could see that her body was not set up for healing. All her diaphragms were restricted. Her autonomic nervous system was all jacked up, and she was in vasoconstriction of all her vital structures, and also increased lines of tension and congestion in her left leg and left arm. So this indicated a total body. So I did a total body evaluation. We did a total body approach. And we have 3 different classes there, TBB, total body balancing. And that's the skyscraper principle. That's the orthopedic model. That means that if someone has a lot of tension in the legs, if we can release those and release everything from the bottom up, think of your head and neck as the penthouse. So we work from the bottom up. But if the problem, and that's what she had, you can see that she had that left foot, 4 surgeries there, and there's a line of tension from that left foot going all the way up to the cranium. So once we were able to release that, we took care of her pain. It was like 2 visits. Now, if somebody had lymph balancing total body, how do we find that? Well, we would find total body findings everywhere, but everything was congested. If I tried to compress, I was met with resistance right away. The legs were heavier. When I palpated the abdomen, very congested. All the diaphragms were congested. Over the sternum was congested. So it's a totally different feel. So they're both total body treatments, but total body balancing, you start at the feet and work your way up, orthopedic model. Lymph balancing total body, you have to start at the heart and work your way out, because in lymphatics, you have to move from a high to a low pressure. So everything has to move to the heart. So if this area is all locked up, you have to deal with that first. And then we also have energetic balancing. That's a total body energetic approach. Okay. Here's my, oh, we made it in, perfect. Here's my contact information at the D'Ambrogio Institute. I also have a YouTube channel that shows me doing some more videos. That's my email address. And I'm in Sarasota, Florida. So I'm going to be talking at the FSMTA. And the title is going to be Lymph Balancing Total Body. So you'll be able to see those evaluations and treatments. I think we're doing that over 2 days. All right, good. So we got that in 30 minutes. Donnell, you can come on back and we'll see if we have any questions.
Oh, well, hi. I don't know if I saw any questions.
Okay.
Come in. Let's see. No, but everyone in the audience still has time to send in questions and we'll get them answered. Now, Kerry, I've seen in some offices like a grid, a big, full-size chart. Is that used for the same purpose as what you just walked us through?
Yeah, you can buy those grids, or that's old school, isn't it? Yeah. Where you would line them up and you could take a picture. But now on the iPads and that, they have the grid already in a program. So you can actually take a picture of someone and you can see all the imbalances. What I did tonight is just basically to show you a full body screen where we looked at the legs, the arms, the head and neck, and the trunk. So we covered the whole body in 5 minutes. And then we looked at the autonomic nervous system. And the main reason why we're doing this is when someone comes to me with a knee problem, in this case, a neck problem, I want to quickly decide, is this a local problem or do I need to address the total body? Just like that woman who had 10 years of neck pain. The reason why she was in all that problem is everybody looked at her locally. Within 5 minutes, I knew it was total body. And once we started to release those lines of tension from the legs up, we were able to get her relief. The other person When we evaluated him, his legs were fine, diaphragms were fine, everything was just local. So then we apply the principle of ARTS, A-R-T-S. And when we did that, we quickly found out that muscle balancing was the priority. So it's a very quick system where you can evaluate someone in about 5 minutes and make a decision right away to see what direction you're going to go in.
Ryan has a question.
Okay.
What are you looking for when you find one limb heavier than the other?
Okay.
Example,
Good question. So what I'm doing is I'm a lawyer. I'm putting a case together. And what I'm trying to see, it's a total body screening examination. It's not a specific evaluation, it's a screen. What am I screening for? I'm screening to decide whether this neck patient coming in or whatever it is a total body or a local patient. That's what I'm doing. So when I'm checking the legs, I'm feeling, are they heavy, right? And when I teach this class live, you know, if we have like 50 people in the class, half of the people are lying on tables and you're going from table to table, feeling everybody's legs. So that's the best way to learn, is just feel lots of people. And we usually go to the lighter leg and then we'll do the tests on the lighter leg and compare it to the heavier leg. The other two tests, the leg circumduction, you're feeling for lines of muscle and fascial tension that could be coming up the leg into the trunk. And when I do the leg compression, normally I should be able to compress all the way to the head and then distract. But with some people, if they have a lot of problems, you can't compress at all. Just like that woman with the 10 years of neck problems, that left leg was heavier. I could hardly move that leg. And when I tried to do a leg pump, it didn't work at all. So you're quickly screening the whole body to see if there's other parts of the body that could be affecting the patient's ability to heal.
Okay. Someone's asking about any downloads. I'm wondering if that's for your presentation tonight, which we will send out tomorrow in a follow-up email, along with a link to this recording tonight, Gail. So do watch your inboxes tomorrow for follow-up information on the recording link for Kerry's tonight, and also a copy of his PowerPoint presentation. Now,
and you'll also get you'll get a handout. It's a little manual, and then you'll get that 2-page handout that basically describes, you know, all the tests in detail.
Great. Another question came in. How is approach work for someone with a frozen shoulder?
Same thing. So if somebody comes in a frozen shoulder, basically it says that that shoulder is stuck, right? It's not moving. I had a baseball player who's playing for the Florida Gators, and he came in and he had shoulder dysfunctions, very limited range of motion, and he was getting very nervous because it was end of July and training camps around the corner, and he had gone everywhere. And basically, what did everybody do? Ultrasound, electrical stim to the shoulder, rotator cuff exercises. So when he lied down, I did this full evaluation, and what did I find? Both legs were restricted. His pelvis was restricted, you know, and then what happens is, as soon as we bent both legs, I was able to move his arm, and I started to work on his legs, and right away his dad stopped me. He goes, "Aren't you going to work on his shoulder?" And finally his son says, "Dad, just shut up, just let him do his work." And I purposely did not touch the shoulder. I did everything else. So I'm releasing lines of tension from both legs into the system, the other arm, the head and neck. So I'm opening up the diaphragms, and I'm doing it in a very gentle, rhythmic fashion, because that relaxes the autonomic nervous system. Because how does a shoulder heal? It heals by blood supply coming to the shoulder, but also drainage from that shoulder. What are your obstacles in the way? And also there can be fascial lines of tension from the legs coming upwards. So with this guy, he's still a patient of mine. He comes in because when he's at college, what does everybody do? They just do local treatments. And when we started to do that, he was able to go to college, and he did quite well. So it doesn't matter if it's a frozen shoulder, neck, whatever. I still want to see, is there influences coming from everywhere else? If they're not, if it's all local, then I want to scan that frozen shoulder. Is it a fascial problem? Is it a joint problem? Is it a muscle problem? Is it a swelling problem? Typically, it's a combination of different things.
Well, thank you. Before I invite Jackie Halderman in for a few minutes, I just want to ask you again about the in-person events that you're doing, you'll be at AMTA National. Are you doing in Tampa in August? Are you anywhere else between now and August in this country?
Are you talking to Jackie or me?
No, I'm talking to you, and then I'll let Jackie add.
I am in Brazil this weekend and Japan, all on Zoom, of course. Every week I've been teaching all over the world. We were just in Europe and that, but I'm in the FSMTA coming up, and I think we have a lymphatic class online. So, and that, these online classes have been working out really well, even for manual therapy, because with Zoom, this is the main room. I do all my lecturing. I've made all videos so you can see it, but then we go into smaller breakout rooms with small groups of people, maybe 4 to 6, and we have TAs, teaching assistants. And as long as you have a camera, we can watch you as you work on someone. And it's actually better. Well, it's always better to have somebody physically touching you, but you have one person that's watching your every move. So they're seeing if you're doing it correctly. And I think we allow people to come in and take the class live and do testing and all that. But we have, Jackie can tell you all the programs we have. We have a whole bunch of programs coming up. I just know what I'm doing this weekend. And the FSMTA is coming up.
Well, you're ahead of me. Well, that turns it over to Jackie, who is the marketing director at AHI and the Upledger Institute. And Jackie,
she tells me where to go. She tells me where to go. So she's my boss.
So first of all, thank you, everyone. And Kerry, of course, it was a great job. And we've had a lot of requests. So I will tell you, Kerry will be at FSMTA in St. Augustine in June. And then after that, he does have some room left in his lymphatic balancing the total body class, which is a virtual class, like he mentioned, on June 24th. So if you are interested, you'll be getting a letter from us and from us as well, from the D'Ambrogio Institute and from me and Elise Dowler, who's also on. You'll be getting an email from us about the upcoming classes and a little offer we have for you. So watch for that class. The next lymphatic balancing class is June 24th. That does have some space. And then let's see, Kerry's got a total body class coming up. Not until September is that one, but there is another lymphatic class in August. And all of this information and links will be in your upcoming email. So, and he's got a very exciting thing you also might want to watch for on our website on August 7th. He's part of the best practices in integrative evaluation. And that's going to include a member of the Upledger Institute, which is cranial sacral therapy, a member of the Barral Institute, which is visceral manipulation, and Kerry. And it's all about integrative evaluation, and that'll be on August 7th. So we'll make sure we include all of that in your upcoming email. And again, thank you very much.
Great. There's a lot of interest in learning more about where Kerry will be presenting and teaching. Before we go, again, thank you both. And to our audience, thank you for joining us. June, we have a very, 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 very full EduTalk series month. We're doing 3. And we start on June 8th with Doug Nelson, who will present the art of clinical decision-making. And RSVP's open tonight. So you can, while you're still on your computer, you can RSVP for Doug Nelson's The Art of Clinical Decision-Making. June 15th, we have James Weslowski, Integrated Manual Therapy for Low Back Pain, Hip Pain, and Sciatica. And those reservations will open the evening of June 8th. The same night that Doug Nelson is speaking. And then June 22nd, we have Judith Koch Stapleton presenting Prenatal Massage, Why Specialized Training Matters. And her RSVP is open June 15th. Thank you again, and join us. Watch your inbox for follow-up information from Kerry and the Upledger Institute. Thank you so much, everyone.
Thanks, Danelle. Bye-bye.
Okay, bye-bye.